Hi, my name is Brian Gomez, and today I'll be demonstrating how to set up an IV. So I'm first going to check the doctor's orders, make sure that he ordered an IV, and he did. So I'm going to go ahead and enter the room. I'm going to wash my hands. I would don gloves if the patient was in isolation or if I knew that there was any bodily fluids around, but there is not, so there's no gloves today. So my hands are washed. I'm going to identify myself to the patient and also identify the patient. Hi, my name is Brian. I'm going to be your nurse today. Can I identify your first and last name and date of birth, please? And he tells me it's Mr. Smith. And I say, okay, Mr. Smith, the doctor ordered an IV set up today. Do you have any questions at the moment? He says no. So I say, okay, so can I just assess your site real quick and make sure everything's okay? So I don't see any distension or any redness or anything. At this point, I also would have had my instructor or whoever's over me go ahead and flush the line, make sure it's patent and everything's okay and good to go with that. So everything's good? Okay, Mr. Smith, I'll be right back. I'm gonna get your IV equipment. So in some situations, this would be in a med room, but for this purpose, it's going to be already in a room. I have the IV bag as well as the primary tubing and some alcohol wipes here. So I'm going to first get my IV bag. I'm going to take it out of its container. I'm going to make sure that there's no particles floating around, everything is good, and that the expiration date it hasn't reached past its expiration date. So this is good. I'm also going to get my primary tubing. I would shut off or clamp it off as well right now. And simultaneously, I kind of want to wind this up so it's not dangling unnecessarily. Again, the both ends are sterile right now, so I don't want to contaminate that with anything else. So I'm going to go ahead and bring this towards my patient. And since I turn my back on my patient, I'm going to say, hey, Mr. Smith, doing okay? Just make sure it's still him, identify his name, and first name, last name, and date of birth again. And again, just looking at the site, make sure there's no issues. I have the bag here. I would have also labeled this date and time and signature so that we know when this was given. And also with the tubing here, I would have also labeled labeled as well so that you know it has to be changed after 72 hours. So right now we're going to go ahead and spike the line. And then we're going to prime it as well as flush it to get any air bubbles out. So you're going to remove the cap here. Again, this is a sterile situation, so you don't want to touch that unnecessarily. If you did touch this top, you would have to throw that away. And the same thing also here with the spike end, you want to make sure that this doesn't touch anything unnecessarily as well. Again, the clamp is shut off. So you're going to go ahead, and some IV bags will let you squeeze out air ahead of time, some won't, but this one does. So I'm going to squeeze out some air right now. I go ahead and spike. Again, keeping the line in eye view as well, and above your waist. So I'm going to go ahead and hang the IV bag. Now we're going to go ahead and prime the tubing. So here in this chamber here, we're going to fill about a third to halfway away, so just simply squeeze it. And now we're going to look for any air bubbles while we're flushing the line as well. So this cap here, we can either take off completely or partially unscrew. I prefer to leave it partially on, that way you're not overexposing it to the environment, which again can lead to any sort of contamination. So I'm going to go ahead and open the clamp. And now you can see that there's fluid dripping, or solution fluid dripping, and I do not see any air bubbles or any leaks in the line, so that's all good. So I'm going to go ahead and just screw this there. Again, you can either hold this or keep this up above up here, make sure it's not touching anything else. Now I want to make sure I scrub the hub of the patient. So I'm going to go ahead and grab an alcohol wipe. And actually, as I begin, so I'm just going to make sure again the patient's still okay. Doing okay, Mr. Smith? And the line's still good. It's still Mr. Smith. I'm going to raise the table up to my working height. I do not need to drop the arm rail because it's not really my way. And I'm going to go ahead and scrub the hub for about 15 seconds. Okay, let's say it's 15. Now I would attach the tubing. Now go in here. Now again, because it's mannequin, we're not going to plug this in. And now we're going to adjust the rate of the IV. So this is in the patient right now. I'm going to go ahead and do 60 drops per minute, which is about 15 drops per second. So we're going to watch the chamber here. And I'm going to start here at the 6. So now. So it's a little bit slow. I'm going to start now at the 11 mark right now. Okay, that's pretty close. Start one more time at the 15 just to make sure. And now. Okay, so that's about 15 drops for 15 seconds. And so let's send the patient. So I'm gonna go ahead and make sure the patient's okay. Mr. Smith, you still doing okay? He says he's okay. I'm gonna go ahead and did not lower the arm rail, so that's gonna be raised already. But I'm gonna go ahead and lower the table to its lowest position for safety. I'm also gonna leave a call bell here for him in case he needs anything else. I'm also going to leave that at this point. I would leave the room. I'd wash my hands. I'd also document anything that was noteworthy, as well as the rate that I set the IV at. And again, the tubing should have been labeled for 72 hours. IV is 24 hours, and that is how you set up an IV for a patient.